Welcome, everyone. Thank you for joining our video series on the 2026 final Medicare Physician Fee Schedule. My name is Reema Taneja, and I am Senior Counsel at Nixon Law Group. I've been at NLG for about 5.5 years now, and I'm joined by our founder and managing partner, Carrie Nixon, who is obviously a leader and expert in the virtual care management and overall digital health industries. Our firm focuses exclusively on healthcare innovation, so we have the opportunity to work with some of the most creative and ambitious founders in the digital health space. As part of our commitment to staying up to date on relevant updates in this industry, we closely follow the Center for Medicare and Medicaid Services proposed and final Medicare Physician Fee Schedule rules each year. We analyze them in detail for implications for our clients. And this year, we decided to create a video series to highlight changes and clarifications from the 2026 final rule. This is the first of 3 videos in our rapid fire video series, during which we will be focusing on highly anticipated updates to the Remote Physiologic Monitoring and Remote Therapeutic Monitoring codes. Before we get started, please note that while we are lawyers, we are not your lawyers unless we've formally engaged with each other. This video is not legal advice. It's meant for informational purposes only. If you have questions after, please reach out and we'd be happy to assist. All right, our first question for Carrie is, what is the most significant change to the RPM and RTM codes in the 2026 final rule?
Hi, everyone. It was indeed a really important year of change for RPM and RTM. So CMS introduced shorter duration reimbursement of device codes and reimbursement for monitoring codes. And this really opened the door for post-discharge recovery use cases, weight management use cases, and other behavioral interventions. These codes, as many of you may know, had been in the works for several years at the American Medical Association CPT committee, and the remote monitoring industry is really, really excited to have them finalized. So specifically, CMS finalized a reimbursement code for the supply of device for remote physiologic monitoring for 2 to 15 days of data transmitted during 30 days of monitoring. And they did the same for the corresponding remote therapeutic monitoring codes, for example, 98984 and 98986. This was to supplement the existing codes for supply of device that were for between 16 and 30 days of data transmitted during a 30-day period. At the same time, and sort of correspondingly, CMS decided to adopt new 10-minute treatment management codes for both RPM and for RTM. So the RPM code is 99470, and the RTM code is 98979. Now, this means that if you get between 10 and 19 minutes of treatment management services during the course of a month, you are now able to bill one of those shorter duration codes, and those are valued at about half of the existing 20-minute codes for treatment management services. Exciting changes.
Question number 2, how is CMS changing reimbursement for RPM and RTM device supply?
Okay, so this is another change. Previously, CMS had been using RVUs to determine reimbursement amounts for the supply of device. But CMS decided this year to shift away from the use of RVUs for device supply to using OPPS cost data in calculating the reimbursement amounts for both the RPM and the RTM device supply codes. So OPPS data actually reflects information that's used to determine Medicare payment for hospital outpatient services. And the thinking is that, this signals a move towards more standardized, more transparent pricing for remote monitoring technologies that actually reflects the cost of the devices themselves. So now we're looking to the outpatient prospective payment system, the OPPS system, to be sort of the baseline for reimbursement for RPM and RTM. So the result that we have overall is that the RPM device code is going to pay about $4.40 higher than was the case in 2025. While interestingly, the RTM device codes for musculoskeletal and respiratory services will be about $3 lower than 2025. And this is sort of an artifact, frankly, of the fact that the RTM device codes are younger and there is less cost data available for them. So it's really important to keep in mind that when 2026 comes along, usually about a month or so after the first of the year, the CPT lookup tool online is really a good way to find the exact reimbursement rates in specific localities. I'll also note for you that the amount of reimbursement for supply of device actually is the same regardless of whether the device transmits between 2 and 15 days of data during the month, or whether it transmits 16 to 30 days. And this is actually because the supply of device code is a expense only code. And this expense for the device doesn't vary depending on whether it's 2 days or whether it's 18 days of data. So just for those of you who are kind of scratching your heads wondering why the reimbursement amounts are the same, that's the explanation.
Very interesting update from CMS.
Definitely.
All right, our last question is, did CMS change what counts as live interactive communication for RPM and RTM?
This is actually a really good question, and the answer is we're not sure. This came in response to a comment submitted to the proposed rule where a commenter asked about whether or not text communication counts as a live interactive communication for purposes of reimbursement for CPT codes 99457, for example, and 99458, and then also, of course, the corresponding RTM codes. So it is my belief, and it's really sort of open to interpretation, that CMS's response really explained that, the interactive communication codes sort of depend on what is going to happen in the CPT committee, or I'm sorry, the CPT manual. And the CPT manual is put out by the American Medical Association, and it generally explains some of the parameters around how CPT codes are to be used. It's really important to note that in 2021, the final Medicare Physician Fee Schedule said very clearly that the interactive communication requirement for these codes had to involve at a minimum real-time, synchronous, two-way audio that could be supplemented with video or other data. So in that rule, CMS was very clear in saying that text messaging would not be considered a live interactive communication. In the response to the comment in this year's final rule, CMS again said we're not going to CMS actually said we're not going to sort of redefine interactive communication. It's probably better to turn to the CPT manual, and if the CPT manual defines interactive communication a different way, we're going to just go with whatever the CPT manual says. We've checked the CPT manual. At this point, it doesn't say anything about live interactive communication. So the safest route is probably to not consider SMS text messaging to be a live interactive communication. Again, it's a little cloudy.
Thanks, Carrie. All right, that concludes part one of our 2026 final MPFS rapid fire video series. Here's some information on how to get in touch with us if you would like to discuss further. Thanks again for joining, and we hope that you found this video helpful. Our next video in this series will focus on updates in the 2026 final rule as they relate to upstream drivers of healthcare, so be sure to check it out.